Welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat, and on this episode, I'm welcoming back a guest that I had a long time ago, closer to the beginning of this podcast, about 8 years ago, the amazing Parijat Deshpande. She is a high risk pregnancy expert, and she's done phenomenal work in this space. I'm so excited for you guys to hear this episode because not enough people really specialize in high risk pregnancy, but really to the level and the degree that she does, bringing in the somatic, bringing in the mental, emotional, and the whole experience of somebody going through a high risk pregnancy or worried that they might be. She is the founder and CEO of Ruvel, the only trauma informed wellness company specifically dedicated to improving high risk pregnancy outcomes, reducing preterm birth, and supporting parents on the entire high risk pregnancy journey. She is on a mission to end the high risk pregnancy crisis and has served and supported thousands of clients through her live events, one on one work, and her best selling book, Pregnancy Brain, a mind body approach to stress management during a high risk pregnancy, and the Body Language Journal. In this episode, we're talking about what high pregnancy even is and a lot of the things that come along with that designation. And furthermore, how anxiety and trauma and previous experience of a high risk pregnancy can impact somebody. It's an important discussion, an important conversation, and I know you'll walk away knowing a little bit more, but also having really good resources. So let's welcome Parijat. Welcome, Parijat. Thank you so much for being here.
Hi, Kat. I'm so glad to see you again.
Yeah, it's been a while, too long, really, since we've talked here on the podcast. You did
Yeah.
several episodes with me early on in the podcast. It's been years now. But
Yeah.
in those episodes, you were doing a high risk pregnancy work, really, really important work at that time, and you still are. And I'm really
hmm
excited about what you're doing. I find you to be kind of like on the edge and pushing forward really important work here in the high risk pregnancy space, but just also, reproductive health in general. It's one of those areas that just needs the attention, and the way you bring attention to it is just, it's so important because it comes from a compassionate space. It comes from a space of understanding and like real resources for people. So I'm really excited for people to hear about what you're doing.
Oh my gosh, thank you for saying that. That means a lot.
Yeah, it's really great work. Yeah, I want to talk about the company you founded, Ruvel, and but what I want to talk about also is the how and why you're doing this company and this work and providing these resources. So for people who are maybe new to high risk pregnancy and what that means, can you just give a little primer on that?
Absolutely. High risk pregnancy is a really vague term. It's one that's used a lot, but it actually doesn't hold too much meaning because of how vague it is.
Right.
It really just means a pregnancy that is at risk for developing pregnancy complications or fetal complications or both. And the impact of that can mean anything from you might need one extra test, or you might need regular monitoring more than usual, or you may have additional specialists on your team, and anything in between.
Hmm.
What it does not mean is anything about the outcome of the pregnancy. I think when we hear high risk, a lot of us get really scared and we just start
Totally.
assuming something horrible is going to happen.
Right.
And sometimes there are challenges that do affect the outcome of the pregnancy, certainly, that can happen, but it's not a guarantee. So if you're diagnosed high risk for any reason, it does not say anything about the guaranteed outcome of what's going to happen.
Hmm. Oh, thank you for saying that. And I'm to your point, like it covers so much of a wide range. High risk can just mean that you're over 35.
Yeah, in the
That's
United
still an
States, over
indicator.
35. Yeah,
Um,
exactly.
but it doesn't, like you said, it doesn't say anything, but it sort of puts people just arbitrarily by this number and maybe some, I don't know, some other reasons. But um, people who are having pregnancies 35 and later are sometimes surprised to find out, like, high risk, what does that mean? And it adds this other layer of anxiety.
Yes, exactly. And it really could just mean that because you're over the age of 35, statistically speaking, more often than not, you may benefit from more uh, monitoring.
Hmm.
we think of it that way. I had somebody describe it recently as it's an extra care pregnancy, which I really loved that description of.
Yeah.
That it doesn't say anything about what's going to happen, although it does say that you'll likely need some
Hmm.
extra care of some kind throughout
Hmm.
the time that
Right.
you're pregnant.
Right. So, right, we won't be able to get into all of the considerations, I guess, that put somebody into this category of high risk pregnancy. But I love that you're really letting people know that it doesn't have necessarily anything to do with the outcome. I mean, there's so much anxiety, right, associated with just this indicator of high risk pregnancy.
So much, so much. And I think so much of that really just comes from when many people are diagnosed high risk, they don't know why. And
Hmm.
they're not often explained why that is the case. And I think that's a huge issue in our medical system right now. There's just not good enough communication.
Hmm.
But when we understand why, and like you said, it might just be because of age. It might be because you have a history of recurrent pregnancy loss. It might be because you have a history of asthma, depression, kidney disease, cardiovascular disease. It might be because you're pregnant with twins. It might be something else in between. I certainly, as you know, had a micropreemie, and so if you have a history of preterm birth, well, then the next one will be considered high risk because you are at risk of delivering preterm, for example.
Hmm.
And so I think the more we can have those discussions with our medical team and really demand those answers, say, tell me why. What exactly is making this high risk? And when you consider me high risk, what does that actually mean for my care in
Hmm.
the next few weeks, the next few months, or for the duration of the pregnancy? The more we are clear about that, I think that helps a lot with that anxiety because now we understand a little bit better of what they're thinking and how they're considering our situation.
Yeah, absolutely. I mean, just those questions that you just laid out are so important, and I just really want to focus in on that for a second because sometimes people don't even know what questions to ask, or sad to say that they can ask those questions. Some folks are still feeling like, well, the doctor knows, and they'll tell me when I need to know something.
Yeah.
But there's a big part also of what you do is empowering people to ask the questions, which ultimately can help reduce some of the anxiety. Just like being informed is a really powerful part of managing this and anything really.
Yeah, exactly. I think we can't overstate the importance of being informed as a patient.
Hmm.
I think we come from a culture, I come from two cultures, both the American culture and the Indian culture, where there's a lot of power given to a medical provider
Sure.
and that assumption of, okay, well, you'll tell me when I need to do something.
Hmm.
And truly, through my personal experience of all of this, it was so obvious that even if I had the best medical team, which I did. I loved them all. I was living in my body and I could feel something was wrong before anyone else could track it, right? Because by
Hmm.
the time I got to the appointment, by the time I did the blood test or did the ultrasound, it was my responsibility to figure out something's not right. What that is where they come in and help me figure that out. And that was such an eye opening experience of we can't hand that power over to anyone, whether it's a medical provider or anyone else, when it's our body, our child, that we are actually the experts of. And I think we don't give enough credence to that. And we don't remind ourselves enough of your expertise really does matter. It is on par with the medical expertise of the people that are on your team. And it needs to have equal footing in that room in every single conversation.
Absolutely. So you mentioned a couple different scenarios, like people going into maybe a first pregnancy, and for whatever reason it being deemed a high risk pregnancy. But there are other pregnant where you've had a pregnancy, there was challenges or difficulties during that pregnancy that makes the subsequent pregnancy automatically in this high risk category.
Right.
So assuming that people are going into a second pregnancy with a certain level of stress already,
Yeah.
how does that impact somebody's pregnancy, their mental health, their you know their well-being during that pregnancy?
Yeah, absolutely. Those are actually the people that I end up working with privately
Mm-hmm.
are the people who've already had the lived experience of something has gone wrong. They had experienced a loss or multiple losses, a second trimester birth, second trimester loss, neonatal loss, something like that, preterm birth, NICU stays. So when they're going into the next pregnancy, they're not going in anxious about what could happen. They are afraid of what happened before happening again.
Mm.
And I think we cannot state that clearly enough, because I think what they end up hearing from people around them is, well, don't worry, it'll be okay. That won't you have, a new provider, you have a new all the things, right? But what they're remembering is lived experience, right? And I like to remind people that if you go into a lion's den and a lion comes and attacks you or roars at you, I think that would be scary enough for me. Just the
Right,
roar.
right.
Um, when you go back into the lion's den, how can you not be scared?
Mhm,
Because you have lived experience of it. You have both cognitive and somatic memories of what just happened.
mhm.
And that's what people are going into in their subsequent pregnancies, is a lived experience of something going wrong. And in most cases with the clients I work with, it's something going wrong and they weren't believed.
Ooh,
And so there is these multiple layers
yeah.
of fear
Mhm,
that are going into that. And I think one of the reasons why they come to work with me is that we know stress physiology affects reproductive health.
mhm.
And that's not in the sense of saying, well, you're too stressed out, so calm down, and then suddenly fertility or pregnancy will magically get better. That's
Right.
totally not what that is.
Mhm,
But we know that the impact of chronic or traumatic stress affects our endocrine and our immune systems in a way that does set the stage for pregnancy complications going forward.
mhm,
And so they see it as like, okay, I'm, doing the prenatal vitamins, I'm changing my diet, nutrition, I'm getting the prenatal care, and this is one more piece of that puzzle
mhm.
that's necessary to support a healthy pregnancy going forward. Um, and so I think it's important for us to then remember that this is not about calming down or relaxing or just thinking positive. This is really about acknowledging that lived experience they're coming into that next pregnancy with, which also means they're well versed in the lingo. They're well versed in what's possible and the blood work that's required and the testing that's required. And so I think it's really important for anyone on their team at their table to acknowledge that they know, and they know at a level that is different than somebody who's pregnant for the first time. Not necessarily a better level, but a different level, and that needs to be honored in every conversation that you have with them as you're creating your treatment plans for your prenatal care.
Right. So, yeah, I mean, there's just so much in there. With can you go back to just like the stress physiology part,
Mhm.
to describe for folks really what that is?
Absolutely. So when we talk about stress, we usually talk about it incorrectly.
Mhm,
And so there's the expectation that stress is a mental health issue or it's a cognitive issue. And if I just change my thoughts, it'll go away.
mm.
And for anyone who's tried that, you know how well that actually works.
Mhm,
And so, what I like to talk about when I talk about stress as it pertains to reproductive health at any point is that it is a physiological chain reaction. What that means is when your body assesses a threat, and if you've read Pregnancy Brain, I use the example of a bear, but it could be anything. You're walking down the street and you think a car is coming a little too fast as you're crossing the street. That counts too, right? You're preparing for a presentation at work. That counts too. It's really any threat will change the way your blood flows, your muscles activate, your posture, what movements your body will support and what movements your body will not support. And at a deeper level, it's going to make changes to your endocrine system, which is your hormonal system, and your immune system, which is specifically for reproductive health related to inflammation,
mm,
in a way that is supportive of surviving that threat, primarily to survive that threat, which means that in the moment, if it happens, you're crossing the street and the car's coming too fast, yes, those changes happen, but then they come back down to our regular baseline in a very predictable fashion.
mhm,
When we're living with chronic or traumatic stress, those changes last. And those lasting changes do have an impact on our overall health. When we hear people talking about or research talking about stress is related to cardiovascular disease or diabetes or things like that, this is what we're talking about.
Mhm.
is that those changes at the cellular level, when they don't come back to baseline because of chronic or traumatic stress, which is essentially a threat cycle that is kind of not fully completing or is stuck and can't complete, those long-term changes to immune systems or the endocrine system specifically for reproductive health can have set up the stage for risk factors for pregnancy complications like preeclampsia, gestational diabetes, and preterm labor, things like that.
Mhm. Okay, so when something goes from a short-term stressor, people kind of return back to somewhat of their baseline. When they don't, like, what are things that people would notice, like if they're not kind of returning back to their baseline? How would somebody even know that they're continuing to be
Yeah,
activated?
that's such a great question because one of the things that makes this extra challenging is that if we think about our systems like a thermostat, our thermostat will adjust. And so we almost forget what that baseline feels like if we've
Hmm.
been in this state for too long. So I love that you asked that. Um, a lot of times what I see is people are either just chronically just jumpy, things, loud sounds, loud, uh, kind of lots of conversation, lots of overwhelm. You feel a little jumpy and it just doesn't really go away.
Hmm.
I think the biggest, I would say, sign, so to speak, is that you try
Hmm.
all the things,
Hmm.
and you get some relief and then you go right back.
Hmm.
And I think that's a really good indicator, just
Hmm.
very vaguely to put it out
Hmm.
there,
Hmm.
that you're probably in some kind of incomplete threat cycles. Either they're not completing fully
Hmm.
in chronic stress, or they're stuck, which is in traumatic stress.
Right. So, like a constant trying to figure out or fix or um,
Yes.
get answers, or like the things that you are hearing, getting, receiving. You said help for a minute, maybe. Right. But then
Yeah, yeah.
that's really tough because there's a certain amount of just trying to seek, if I can, safety. That like things are going to be okay, and when there's not, um, when you kind of know ahead of time what an outcome might be for something, you can have some relief. If you like, it's fairly predictable, but this is not always predictable.
That's
And
right.
you don't always know during pregnancy how things are going to, like, you're finding out how it's going as it's going.
Yes.
And that it can make it so much harder uh, to feel secure that things are going to be okay.
Yes, exactly. And I think that's where I will fully own that I am pro control. I am very pro control. I'll take the control, you take the control, let's all be in control. And what I mean by that is when you're absolutely right, during pregnancy, you can do everything picture perfectly and still something can go wrong, right?
Mhm.
That is because we just don't know enough about pregnancy physiology.
Mhm.
That's a whole other conversation about why that is.
Uh-huh.
But you're right. Like we cannot, no matter what you do, you cannot know for sure what's going to happen.
Mhm.
And so a lot of why I love the somatic approach to pregnancy and stress physiology is that we learn how to control what we can control.
Mhm.
And part of that is learning how to experience that sense of safety, as you said, security, that sense of um, baseline
Mhm.
despite being in a state of uncertainty.
Mhm.
And when you can practice that, and I say it as if it's just like, oh, just go do it. I recognize it's very difficult to do. And that's why we usually start before pregnancy, before all
Mhm.
those changes start happening. So you have the lived experience of a familiar muscle to lean back on. But I think when we can really learn how to shift our bodies in a way that we are no longer kind of set off by that uncertainty, and we can lean in on all the things that we are controlling and that are in our control, it does make the experience a lot smoother. And it also makes the experience more reliable in the sense that even if something happens, and I've had clients say this before, kind of at the beginning of our work, is I want to know that no matter what happens, I can look back and say, I've done everything.
Mhm.
And that's really what we end up with. That's how we protect ourselves from that sense of regret and that sense of looking back and going, I wish I had.
Right.
What if I had, right? Those ruminating thoughts we end up
Yes.
having of, was it that one thing that I did that one day? Those
Mhm.
things we protect from that when we can rely on this aspect of control and learning how to tolerate uncertainty.
Yeah, and it's so difficult with pregnancy. Well, really in anything that happens within your body, but like pregnancy in particular, you're trying to grow a human, and there's a lot of the responsibility feels like it's on you. So the person who is pregnant is feeling that pressure of I have to do all of the things. It's not like somebody else can necessarily come in and change what you do in your body. There's this interesting thing that somehow, because it's happening in our body, we should be able to control everything and manage everything. And it's this weird, not weird, I don't know what the exact word that I want is, but it's when you like bump up against that limitation of there, you can do all of the things and there's only so much you can do, like the sort of how things unfold. Unfortunately, sometimes people do end up feeling that, like, oh, I didn't do enough. I should have done X, Y, or Z.
Yes,
When, like, there's not really, you can't point to one specific thing and say, oh
that's
yeah,
right.
because you didn't do that, then there was this outcome. It's such a difficult needle to thread, I think.
It is very rarely can you point to one thing and say, because you did this or because you didn't do this, this is why it happened. It is
Mm-hmm.
so complex. And I think the
Mm-hmm.
sooner we can really accept that it is a recipe and there are a lot of ingredients.
Mm-hmm.
And just because you don't have the onions this time, or just because the garlic went bad or something, doesn't mean that there's a guaranteed outcome. It's you're going to do your best with what you've got. And if you can get to a place where you feel really comfortable and confident, I did everything given what I knew and what I had access to, that's the best that we can that's all we can do.
Mm-hmm.
That's all there is.
Mm-hmm.
And we get comfortable with that. And then on the flip side, when we notice those thoughts coming back of, okay, but it was that one thing, or oh, it was because of whatever. And we start turning inwards and we start blaming ourselves for that and carrying that responsibility. I found that when I work with my clients, like I said, because they've already experienced it before, there is an element of that from their previous pregnancy. And we talk about, a big piece of that is who really deserves that anger, because there's a lot of people that we feel we can't express that to. And when we can really go there, my providers, my nurse, my doula, my midwife, my partner, my mother, there are a lot of other people that we feel like we can't go there with. And when we let ourselves go there, we release a lot of that responsibility that we're putting in onto ourselves, because it's easier to blame ourselves than it is, in a lot of cases, than to
Yeah,
turn that outwards to
right.
play
And
me.
you mentioned something at the top too about like the people who come to you are not feel heard. So in my mind, that's also, sure, it could be family and friends, but that's also like the system, or like whoever's involved in the system. I don't know how much you can speak to that. The experiences for people are so varied. But that is one thing that is kind of like out, you can't control what other people do and how other people are, like a provider for instance, but um, you were mentioning some of the things you do to empower folks
Yeah,
in those scenarios to like, yeah, how do you help people to feel like they're listened to?
yeah. Yeah, I think the biggest thing that I do is, and it's gonna sound so simple, but I think it's very impactful and meaningful in ways we can't really express until we've lived it,
Mm-hmm.
is I believe them. And every time they say something, this is gonna sound so crazy, but last night, blah, blah, blah happened. Yeah, I believe you. I believe it did. So let's go with that as a reality. And having that lived experience of having somebody on your team 100% believe you without ever doubting you, I think,
Yeah.
so a lot of that first part of our work together, they're often sharing what happened in their previous pregnancy. And when I can connect the dots for them and say, oh, so you actually recognize that your feet were swelling at week 26, but your doctor didn't really catch it till 32. Like, even something as simple as that, when we go through their medical records and they go, yeah, I was saying that. It was
Mhm.
week 26 or it was week 20. And they said it's not possible at week 20, but I could feel it. That alone, really giving space for that and saying, "No, you knew. You
Yeah.
knew and you know now, and I'm gonna trust you."
Right.
I think is we don't have enough of that in our life, so when it
That is
happens,
true.
I think it's really eye-opening to go, "Oh, this is what I can expect, and this is what I should expect from people on my team." And once that baseline has shifted for them, then we start rebuilding their team together, and I kinda go in through my directory, and we go through their insurance if they have it, and we kinda go, "Who do you need here?"
Mhm.
And I guide them through how to interview them and what questions to ask given what they went through before and what the gaps were before and what we know now about their pregnancy and their risk factors. And we rebuild the whole team so that when they look around at their table, they go, okay, I can say anything and every person here is going to believe me, you know?
Mhm. Right. Ooh, that's really powerful. And I mean, you're so right that it doesn't happen enough. It's like somehow so simple.
Right.
This is not rocket science. It just believing people shouldn't be this new experience. Just being believed shouldn't be a new experience, is what I mean.
Exactly.
It's
Exactly.
yeah. I mean, it's really powerful because right, you have if for somebody who's been through a traumatic experience, um, they're going to need to feel like that they can trust their providers, or at least that there's some sense of safety in order to be able to release some of that tension.
Yes. Exactly.
That is,
Exactly.
it's simple, but like so necessary and really, really powerful. And I know we touched on this just a little bit. Speaking of trauma specifically, so somebody has experienced, um, pardon me, a traumatic pregnancy or birth, or there were traumatizing things in those experiences. Again, going back to the subsequent pregnancy, um, the fear that they could have another traumatizing experience is kind of there, or could be very much there. But does that necessarily mean that the next pregnancy or birth, again, going back to like trying to manage as much as possible with people, how do you help somebody know that they could have a better outcome, or at least yeah, in the next pregnancy?
Yeah. It's That's a tough question to answer,
Hmm.
because I think I can say it till I'm blue in the face,
Hmm.
but there's an element of also you have to be ready to believe that.
Hmm.
And I think that readiness often comes from recognizing that what happened is not my fault.
Hmm.
And there are things I can do differently at the same time for my next pregnancy, being able to hold
Hmm.
both. And I think
Yes.
that's very hard to do.
Yes.
But when we can do both, then we open our eyes to, okay, the next time can be possibly different. And, I like to explain it from the place of now that you know what happened, and I wish you didn't have to go through that fire to know it.
Hmm.
I don't think that that has to be necessary, but I don't control the medical system, so here we are. So now that you know, we can go back and we can recreate the narrative so that you have different questions to ask next time,
Hmm. Hmm.
so that you can bring different people on next time. So much of it is reminding them of where they still have choice because once you go through that, it feels like everything happened to me.
Yeah.
I don't have any choice anymore in the matter.
Mhm.
I was fully there in that
Mhm.
state for
Mhm.
years
Right.
of like, well, all my choices are gone, all my agency's gone. I don't have any power
Right.
because that's what I was made to feel.
Right.
And so we have to like it's not about me telling them that, it's really about them actually experiencing it. So guiding them through rebuilding their team, guiding them through seeing, look, this is how all of this makes sense. I think that's kind of my, if I had a catchphrase, that might be what it was,
Mhm.
is it makes perfect sense that. And then we connect the dots and we go, oh, well, you had
Yes.
this symptom here.
Yeah, yeah.
But if we look back, you could see the precursor symptoms starting.
Mhm.
And then look at what happened here. And when we start to make sense of what happened,
Mhm.
it's no longer this big, scary monster
Yes.
that could just pop out at you at any moment. You get to start to see for yourself and experience for yourself, oh, if I do these things, it'll reduce the risk of this big, scary monster happening again. Right. So much of it, I think, is less of me telling people that and
Mhm.
really just showing them for themselves. Because
Yeah.
at the end of the day, after everything they've been through, they've heard a lot. They've heard a lot of words from a lot of people. And I
Mhm.
have no pretense in believing that my words matter more than anyone else that they've heard
Mhm.
from. I think what's far more powerful is let me show you what I mean by this.
Yeah. Okay, so I mean, all of the work that you do, I know you still do the individual, the one-on-one support and coaching, but now you've branched out into Ruvel. Can you explain what Ruvel is and how it supports people going through the high-risk pregnancy journey?
Absolutely. It's essentially taking everything I've done with my one-on-one clients and putting it into a combination of our shop that has our products and our private members club that basically guides you through everything that I do with my private clients from through fertility, through loss, through prematurity, NICU, and of course the high risk pregnancy. All of that together. So it's essentially just an extension of what I've been doing, but able to reach more people, I would
Right.
say. I like to consider Ruvel. We're really the only truly trauma informed wellness company that's dedicated specifically to improving high risk pregnancy outcomes. And I really want to show people that there's so many different elements of it. And like we talked about the analogy of a recipe, you
Mhm.
can take pieces, take a couple things from the shop, take a few things from our private members club, start putting them together, and you start building this recipe for a healthy pregnancy, for making sure that we reduce the risk of preterm birth, but really so that we can raise healthy children and be healthy individuals ourselves. One of the things I took away from a lot of the private work that I'd done is they were all able to see beyond the next stage. I think when I was going through it, it felt very siloed. You
Mhm.
get pregnant in the fertility clinic, you try to stay pregnant with your MFM, and then you get kicked over to the NICU and you hope your baby survives. That's my experience at least. And then you go to pediatrics. And I wanted that was never good enough for me. And so Ruvel really connects those dots and goes, we're with you the whole way through
Mhm.
for whole body support. Like we talked about, the somatic health, we talked about overall health, and we talked about navigating healthcare. We do all of that
Mhm.
inside that private members club. And there's elements of that in our shop. You take what you need, whatever your recipe is missing, grab that and go and help you on a healthier, safer journey.
Yeah, what you mentioned about things being siloed, obviously this is challenging and problematic for our medical system in general, a care system overall.
Yes. Yes.
So the person has to also make sure that their information gets transferred from one place to the next, to the next, to the next, and they're like the holder of all of this, um, while being at possibly a very high level of stress. And it is hard to remember your own experiences sometimes when you're under a lot of stress. And so, like you saying that there are tools to help people basically like go through each stage, I assume in some way track what's happening, like be able to. Uh, in like hands-on terms, what kinds of things can people use to help them that you provide to help them through this journey?
Yeah, absolutely. So, just some examples. So, for example, in our Ruvel shop, we have Pregnancy Brain course, which is a nice extension to my book, Pregnancy Brain, and that goes through a lot of the sensory experiences of going through a high risk pregnancy and how to navigate anxiety and fear through a high risk pregnancy from a sensory perspective. So, you've got a little bit of that if you feel like that's kind of your primary concern.
Mm-hmm.
That's what we recommend. We have like a body language journal that helps you kind of when you're between pregnancies or after loss, really understand the somatic narrative of what happened. So even if you don't remember cognitively what are those moments and what those details are, your body's always telling the story. So we've got that. In our private members club, we've got all of that, of course, but also guides and worksheets, questions to ask so you don't have to remember,
Right.
question workflows of not just what do you ask, but how do you ask it and in what order do you ask it?
Yeah.
How do you set up an appointment so they're going to listen to you? We've got workbooks and guides on really navigating all aspects of the healthcare system from trying to conceive all the way through once baby is home, whether you had a loss or NICU or everything in between. And then we have a community aspect to this, where we have taken kind of the support group feel out of it. And
Mhm.
it's more of we're going to get together, we're going to connect on this one level that we all share. And so we have mixers for people going through high risk pregnancies, NICU parents, preemie parents, where you know there's a shared language. And you also know that there's a shared sense of hope for the future, even if you don't know how you're going to get there.
Mhm.
And you can feel like you actually belong. I think that is one of the biggest things that I missed during my personal experience that
Right.
really inspired that feeling of let me I wanna know where I fit in because I don't fit in the what to expect crowd, and
Uh-huh.
I don't fit in this, the parenting groups and the mommy and me group. I don't fit there. Where do I fit? And this is kind of what we're offering is a place for people to belong like that. And then lots of opportunities to practice foundational somatic work. We start with the very, very basics, so they're very small, they're very gentle, they're very easy to do, but when you do them repetitively, you get a lot of information about what's happening in your body. So we have a little bit of everything, whatever it is that you need. And the core point of Ruvel really is to offer choice. So you come to us and you go, what do I need right now? Do I need that community support? I'm going to go here. Do I need a course? I'm going to go here. Do I just need a soothing session because I'm just really struggling? I'm going to go rent that from the shop. Like you get to choose because you know and your choice matters. So that's kind of the lead for how Ruvel works.
That's amazing. It's so empowering. And coming from the trauma informed perspective, as you were saying, I mean, it's trauma informed care that you're providing. Empowerment is part of that. Like it just is.
Yeah.
Can you speak a little bit to how what you've seen for people when they feel empowered by your work together or the things that you provide with Ruvel, how that impacts their experience? Or
Yeah.
yeah.
They two ways, I'll say. One is their lived experience and one is their health. So in terms of their health, we can see the changes in their blood work. We can see the changes on the ultrasounds. We can see that preterm contractions stop. We see that blood work stabilizes. We see that hormones start to balance and inflammation goes down. I mean, that is all trackable, which I find
Amazing.
to be so cool.
It's so cool. Hmm.
And I think in the lived experience side of it, there's I don't know how to describe it, but there's an essence that changes. Like
Mm.
the way they talk changes and there's a lot more authority in their voice that
Ooh,
they
I love
always
that.
had,
Sure.
right? Like I
Right, right,
didn't
right.
give it to them,
Uh-huh.
but it was like they found it again. They went,
Yeah, yeah,
"Oh, no." And so it'll
yeah.
start be like our maybe our work will start with more questions first. Well, what do you think I should do about blah blah blah?
Mm.
And within a few weeks, it goes, you know what I was thinking?
Mm.
I think I'm going to do this. I'm like, yeah,
That's
think you
great.
totally should.
That's
uh,
awesome.
and I think that results in a lot more confident decision making, both with their healthcare plan, who's on their team, how they want to live their life. I love it when a client will say, you know what, my dietitian said I have to make these 47 changes. That feels overwhelming to me. I'd like to start with two. What do you think? I'm like,
Yeah.
excellent,
Okay.
because you think that and you
Yes.
know it so well for yourself that
Yeah.
who am I to question that?
Hmm.
Absolutely. Let's start with 2 and we'll work up to 47.
Sounds overwhelming. Yeah. Yeah. But right, I mean, to your point, there are so many things to do. There
Yeah.
are so many things to do, and if you feel like you have to do everything everybody is telling you, or like however many different providers you have, you're going to be overwhelmed.
Yeah.
As a remind people that they have a choice and they have a say and they can do what they think is right for them. Just I mean, makes me feel less stressed just thinking about it. Just
Yeah.
like there there's so much more. I Yeah, I guess I just keep coming back to empowerment, but um just agency. I think that's the word that I want,
Yeah.
is like that internal locus of control. You can make the decision. It's not up to everybody else. You're using their their opinions or their expertise as part of informing what you decide to do. But you're not at the behest of everyone telling you just do this and don't do
Yes.
that.
Yes. Exactly that.
So,
Yes.
well, Parijat, it is a pleasure to speak with you as always. I love how your brain works. It's just you have such a way, and I think your process of just making this manageable and down to earth and accessible is so powerful. And I'm just thrilled that you're out there doing this work.
Thank you so much. And I feel likewise. I love being inspired by everything that you're doing as well and
Thanks.
really appreciate this time.
Thank you so much for being with us. You can find out more about Parijat's work at ruvel.com, and you can also follow on Instagram at the Ruvel. This is such a fantastic resource. Please do send this episode along so that people who are having a high risk pregnancy can know what resources they have and some things to think about as they go through their journey. And if you haven't yet, please subscribe to the Mom and Mind podcast and follow us wherever you can. Share this episode and any episode that you resonate with, because there are people out there who need to know this information, and it's here and it's free and it's available to them. Anybody can access this podcast and the hundreds of episodes that I have here for people to learn and be informed and know that they're not alone in their journey, that help is available and they can get back to feeling like themselves. Thank you so much for being with us. Until next time.